I just want to tell you a little bit about George Washington's chair in Independence Hall. On the back of the chair, there's a carving of a half sun over horizon. At the end of the Constitutional Convention, Ben Franklin hobbled up to the front of the room, supported himself on Washington's table, and said, "I've been asking myself, is that a rising sun or a setting sun?" After the Constitutional Convention, I've decided that it is a rising sun. But what would he say now? I would say the answer to that question is in your hands. It's in the hands of the physicians. We need to have another little declaration of independence and go and do, as we have seen physicians at this meeting talk about, and particularly what Keith Smith is going to talk about now. Just look at the numbers. The Medicare trustees report is out again, and don't pay any attention to when the trust fund is going bankrupt. Already eaten up all the payroll tax. It used to be that Medicare and Social Security were a source of money for government spending. It's all been spent. The IOUs are in the trust fund. It's now becoming a sink for huge amounts of money that have to be, and what I think the administration knows is we've got $2.4 trillion in the healthy sector of the economy that needs to be sucked out to support all of his ambitions. So physicians, if they're taking Medicare, they're dependent on a bankrupt for their livelihood. And patients who are depending on Medicare, and if we have a new public program, they're dependent on a bankrupt for their medical care. And the government really has only one alternative: to cut the spending, and that's by cutting medical care. The only thing that stands between doctors and being turned into Soylent Green is you guys. You need to work for your patients, not for the bankrupts. And I hope that here you've learned some tools as to how to do that. And I hope from Catherine you have learned some tools as to how we have to fight this individual mandate and the comparative effectiveness research that's coming down the pike. Please respond to the call to speak at every opportunity at tea parties. Make yourselves heard. But most important is what you do in making yourself available to your patients. They need you, you need them, and the country needs you. And what is it? If we don't do it, who's going to?